Hey guys, Dr. Andy here. Today we are going to talk about plantar fasciitis. Okay, so plantar fasciitis is probably the #1 most common condition that we see in a lot of our runners. However, it's not just runners that tend to get plantar fasciitis. A lot of our weekend warriors will get it. Think golfers and tennis players, anyone who goes to the gym a lot, anyone who loves to go for long walks. Obviously, they kind of run into it as well. And obviously some triathletes where running is a big part of what they do as well, okay? So the plantar fascia is actually a piece of soft tissue, a tendon that runs along the bottom of the foot, and it supports one of the main arches that goes along the bottom of the foot, okay? So think of it actually as the plantar fascia itself, soft tissue that runs along the bottom of the foot. And plantar fasciitis is when there's a lot of inflammation and micro tears in that fascia, in that soft tissue that is driving a lot of your discomfort. So if you are suffering from plantar fasciitis, very commonly you get along the bottom of the foot some severe pain upon standing when you go from a seated or a laying position. Typically, in the worst, is first thing in the morning, and that's because all night long that fascia, that soft tissue, has basically been kind of creeping up on itself and getting very, very tight, and as soon as you stand up coming out of bed, you put all of that pressure and all of the weight of your body down through your legs into that foot, and it quickly spreads and kind of pulls that soft tissue apart and skyrockets your pain. Okay, so #1 is pain along the bottom of the foot when you first wake up in the morning, and then as you start to move around and start to walk around and get ready for your day, that pain actually typically will start to go down, starts to become less and less. Now, with true, typical plantar fasciitis patients, if you sit a lot during the day, or if you take a nap during the middle of the day, or you sit down for work, very, very commonly upon standing again, that pain will return, but it might not be as bad as first thing in the morning, okay? So always remember, it's the #1 symptom is pain along the bottom of the foot. Worst when you first wake up in the morning, and then throughout the day if you've been sitting for a while, if you've been laying, basically anytime that you've taken some pressure off that feet for a little bit, and then upon standing that pain will return, and then as you move around it will start to get better. Okay, so 2 primary reasons why that is going to happen. #1, which is actually a little less common, but everyone thinks about it as the main driver, and that's a fallen arch, where the arch along the inside of the foot is actually kind of, rather than having a nice good kind of angle to it, it flattens out, and the inside of the foot starts to roll in and starts to actually come into contact with the ground. You'll actually kind of notice with someone like this where their ankles are a little bit rolled in, and physically the arch is kind of rolled, and some of the inside of the foot, instead of being nice up off the ground, is actually laying flat against the ground. Now, that's actually a lot less common because we got tons of plantar fasciitis patients that have fine arches, okay? But really what plantar fasciitis is, it's an overuse injury, meaning that it's really, really coming from tightness and stiffness and basically overusing it. Obviously running can do it, being a triathlete, going out there and, hitting the golf course or hitting the tennis courts over and over and over again, constantly using that area and using the bottom of the legs is going to aggravate it, okay? So the main other reason that we get plantar fasciitis is a repetitive stress injury coming from tightness in the calves. So physically, these calves are so tight, all right? The muscles are so tight that they affect the Achilles tendon and then along the bottom of the foot, and cause micro tears and inflammation through the plantar fascia, and we develop plantar fasciitis that way. So the #1 thing that you can do for at-home care of plantar fasciitis is stretching and working out the calves. So obviously you can use a foam roller on the calves. And the other way to do it is to physically stretch the calf. So you can either, go up against a wall and put your toes up against the wall and lean into it, and you'll stretch through here, literally physically kind of stretching the calf. The other way to do it is maybe put the toes at a higher stair and then lean backwards kind of down the stairs, your back going down the stairs, so maybe use the bottom one, right? And it physically will stretch through this area as well, through the calves as well, okay? Now, if that's not enough, what we do here in the office is a couple of things. #1, we're going to use my hands or a Hypervolt to physically get in here and try and work out the muscle adhesions in the calves, right, that you can't do at home if it's way too tight through the calves, all right? Secondly, we'll probably do some manipulation or an adjustment for the ankles and the knees just to make sure everything is not locked up, everything's moving really, really well. And then we'll probably finish off with some dry needling. Dry needling is like acupuncture, but specifically designed for muscle and joint pain. So we'll throw some needles in the calf, the ankle, and then the bottom of the foot, and we get some really impressive results with that as well. So if you are suffering from plantar fasciitis and just some stretching at home is not doing it for you, give us a call, let us know, and we'll be glad to help you out. Always remember to live with passion and not pain.